On Friday, officials say Patrick White shot 6 buildings at the CDC headquarters, locking down the area for hours. Officials say White died from a self-inflicted gunshot wound. Killed in the shooting is DeKalb County officer David Rose, a father of 3, a husband, brother, and son.
Just know that he was a hero. He did what he had to do.
David would give his all. He wouldn't care about who you are. If you needed someone to help and protect you, he would stand in the line for you.
DeKalb County Board of Commissioners offering a round table of condolences, speaking since this tragedy in their county.
Unfortunately, he lost his life being a hero here in DeKalb County.
Months before the shooting, Cobb County police records show suicide calls from White's home. Records state he did get possession of a gun out of a locker at his home, but returned the weapon back to his father at the time. When asking advocates, how do you approach that conversation?
There are so many ways to tackle this problem, and unfortunately, right now in our legislature, there's just not the will, and we really need people to join us to reach out, and from both sides of the aisle. This is not a partisan issue.
And welcome to the Decatur Dish, where we talk about DeKalb County and the latest of what's been going on in one of Metro Atlanta's fastest growing communities. And Dan, usually we talk about all the exciting business developments and the great stories and the newsmakers, but today we do have a more somber topic, an important one nevertheless, that I wanted to bring forward. As you just saw from our Atlanta News First reporter, we are talking about the passing of DeKalb County police officer David Rose, who gave his life protecting the community that he grew up in when an active shooter began firing at CDC campus near the Emory area. Dan, you and I we were both all hands on deck that weekend in kind of going with everyone through every moment and every development and bringing that news to our respective viewers. Just talk to me about that. The weekend, as you know, we're getting further and further into the week. The wounds are still fresh for so many community members, especially the DeKalb County Police Force, and of course, the family of David Rose.
Absolutely. Wanted to just start off by sending my condolences to Officer Rose and his family and thanking him and them for the sacrifice that he made. That's so important to acknowledge at every opportunity. We were sitting watching TV. I was having a date night with my wife. We were watching TV, and then all of the messages came in on my phone. I was getting blown up every which way, and we called an all hands on deck. I got on Teams and got my team together. We sent Zoe Seiler out to the scene to do the press conferences. I stayed behind on web and did live web updates. It became obvious pretty quickly that this was a targeted attack against the CDC. We were getting pictures from our sources inside the CDC showing the bullet holes in the bulletproof windows. It soon came out that it was a targeted attack against the CDC, spurred on by an individual's belief in what amounts to conspiracy theories about the COVID-19 vaccine. I wish that all of that was surprising. Unfortunately, it's not when you have people with mental illness, as it appears this person was struggling with, and they have easy access to guns. These things are sadly predictable, and there was a collective sense of, we're kind of surprised it took this long given the amount of misinformation and politically charged rhetoric about the work that the CDC does.
I think I saw a couple days ago you took to social media and even said, you know, the power of misinformation kills, and it can result in something like this. And we're, again, learning minute by minute kind of exactly the details of what took place, and it's really difficult to follow, but it's painting a picture for you on the mindset of the suspected shooter, of the type of person that David Rose was when he ran toward the danger, protecting those that, you know, were experiencing this and uncertain of what was going to happen next. So we're continuing to tell this story, and some more controversial conversation has come of it, specifically from the United States Department of Health and Human Services. Talk to me about that.
We covered a rally organized by our guest today, Fired But Fighting. It was a group of ex-CDC employees who were laid off via the doging that occurred across federal agencies earlier this year. We were invited to a rally on Sunday. I'm going to be flat honest, I was exhausted by then, and I did not know if I would have enough fuel left in the tank to go. But these people are my neighbors, and they're part of my community. And I got it together and I went, and the CDC people were very gracious with their time. They shared their stories with me, gave some very powerful statements about what had happened and about Robert F. Kennedy Jr., who's the Secretary of HHS. In that story, I specifically included a quote from Robert F. Kennedy Jr. that he had published on X condemning the shooting. I did not at any point think I needed to do anything more than that. And the statement itself, while it was argued that it perhaps did not go as far as some people would have liked, was conciliatory and apolitical. Yesterday, I was contacted by a spokesperson for Health and Human Services demanding that I update my previous story to include a statement from HHS, to which my response was, oh, this administration's talking to the press now? That's interesting. That's new, because that hasn't happened yet. I said if I had known that you were actually talking to the press, I would have certainly reached out, but I am touched that the HHS saw fit to contact a very small community news website in DeKalb County and make demands about our coverage. I think sometimes, Maria, people think that because we're small, we'll just sort of take it. And that's not how I'm personally wired. So we put out a statement. We updated the original story. We also put out a new story saying that the press, HHS said the press had exploited this tragedy for political gain. I'm not really sure what politically I had to gain by my friends and neighbors being shot at. I asked for that. I was not given an explanation. What I suspect is the real reason that statement came out is because we were adjacent to CDC employees, and they knew attacking the CDC employees who spoke directly in the moment would have been a bad idea. I still don't understand why the statement was sent when the first statement that Robert F. Kennedy put out, again, was just fine and conciliatory and appropriate. I don't know what the inspiration for this antagonism by our government is. I don't know what it accomplishes. I don't know how that helps. But I am touched. I'm sure the HHS is watching this because I am on their radar now. I'm very touched that you read Decatur Dish. Thank you. Call me anytime.
With that, we do bring on guests here when we have topics that are being talked about in the community to continue this conversation. And this one in particular, you know, we look at the CDC, and it has been a very difficult year for the employees, for the staff at CDC headquarters in Atlanta. So joining us here to talk about that is going to be Fired But Fighting. They are a group that works with these people that really is intimate in the fight to help them through these processes, and especially as we're talking about something like this that just shakes a department and shakes a community, Dan. So we will be talking with Fired But Fighting here after this short break.
Joining us today is Sarah Bloim, co-founder of Fired But Fighting, which is a group of former CDC employees who were doged earlier this year and forced out of their jobs. Sarah, hello, how are you?
Hey, Dan, it's nice to be here. I'm doing well.
Thank you for joining us. Sarah, talk to me about your time at the CDC. What were you doing there?
I was a health communication specialist in the National Center for Environmental Health. A lot of people maybe haven't heard of a health communication specialist, but they have heard from us. Every time you hear something from CDC, you are hearing from a communication specialist. We are trained to translate, technical scientific language into something the public can understand.
How long did you work at CDC?
I was there for 5 years, actually maybe a little more, but I was there as a full-time employee for less than 2, which made me a limited tenure employee, which they call a probationary employee, and it made me easier to fire. So I was fired on a Saturday at 8 o'clock at night in February.
To be clear for our viewers, probationary does not mean on a discipline or performance improvement plan or anything like that, right?
Correct. It's just limited tenure.
So you were fired via email on a
Yes.
Saturday?
Correct.
And who did the email come from?
Ooh, I can't even remember the name of the guy. He was an acting. But yes, it was a templated email that was sent to hundreds of probationary employees like myself, citing performance as the reason for dismissal, which of course, in almost all cases, was in fact false. I personally had a 4.6 out of 5 performance review just a month before.
What was the inspiration for Fired But Fighting, aside from the obvious? At what point and how quickly did you get this together?
Well, we are scrappy, so we're in Signal is our preferred way to communicate. There was a lot of, not people sharing misinformation purposefully, but just a lot of people sharing what they could find right away. And so we really needed to increase access to facts and started a newsletter. So that's kind of how it began, and it grew from there exponentially. So now we do a lot of advocacy work. We do a lot of support for current and former employees, and just trying to drive public outcry and get media's attention about what's going on at CDC.
When the firings happened, I don't think people can really appreciate that our community lost hundreds of people who were really well educated and well-paying jobs. From a personal experience, I had neighbors, both of whom worked at the CDC, both of whom were fired on the same day. What has been the economic impact to our community of the layoffs at the CDC?
Yeah, I'm curious to see that also. I mean, like you said, we're your neighbors. We spend money in downtown Decatur. And I think what some people don't realize is they weren't really doing a reduction in force by removing some staff and allowing the activities, the congressionally mandated activities, to move forward. In fact, they just deleted entire centers, including the Injury Prevention Center, which has a program preventing gun death and injury.
Let's talk about the event itself, August 8th. Where were you? How did you learn about it?
I was at home, and I actually learned about it because my mom called me in tears. And then I went into the chats and saw the bullet holes and, just really lost it for a little bit, cried. But then, rage took over, which is my most productive emotion.
Same. How did your mother learn about it?
She also works at CDC.
She still work there?
Yes.
Is she okay?
Yes, she was not in that building because they were doing some work on her floor.
Gotcha. What is the extent of the damage to the CDC based on what you've heard from colleagues and friends?
The report, I think GBI came out with a report that said there were 500 bullets fired, 180 hit the buildings. Doing the sweeps, I think at least 100 of doors were knocked down. So there's extensive damage, and strangely, they seem poised to ask those employees to come back next week, when in fact we've heard that the repairs will take months.
Fired But Fighting held a rally on Sunday. It was very powerful to hear some of these stories, people who had been directly affected by this, people who, for the benefit of our readers and viewers, people in these really nice government jobs tend to not want to talk to the press for very solid, good reasons, because they love their jobs and they don't want to lose their jobs for talking to the press. That has shifted. When the firings initially happened, it was a lot harder to get people to go on record about the things that have been happening. The dam has completely broken on this. We actually published a letter from a CDC employee yesterday. People are speaking up by name, exercising their First Amendment rights under the threat of being targeted or fired. Is that your impression of the change that's happened as well, Sarah?
On some level, yes. I think that people are still concerned about retaliation. If you look at what happened at the EPA, people signed a letter of dissent and were put on administrative leave pending some kind of investigation. But yes, I am seeing people come to our rallies and events without wearing sunglasses and a hat and a mask. I think that the need to preserve the integrity of our profession has driven people to really speak out. It's made people more courageous.
At the rally, several people called for Robert F. Kennedy Jr., the Secretary of Health and Human Services, to resign, and drew a direct line between his anti-vaccine rhetoric and what happened. I will note that while the shooter has definitely expressed in the past their discontent, I think was the word the GBI used, with the COVID-19 vaccine, we have no evidence that we have seen that personally links what Robert F. Kennedy Jr. has said to his activities. Why does the CDC employees feel so strongly about this connection?
There's two reasons. First, Russell Vogt, one of the architects of Project 2025, is on film stating, we want the bureaucrats to be traumatically affected. When we wake up in the morning, we want them to not want to go to work because they are increasingly viewed as villains. So we have that piece already happening. Undermining the people who are serving our country. Then we have this other layer of Kennedy and his ridiculous lies that are, I'm just going to call it what it is, right? They're lies. 3 days after the shooting, he went on Scripps News and says, quote, "Trusting the expert is not a feature of either a science or democracy." He also said that one of the things we saw during COVID is that the government was overreaching in its efforts to persuade the public to get vaccinated, and they were saying things that were not always true. This is the guy that's in charge of HHS. And by the way, this guy has no credentials. He has no medical background. He has no public health background. He went to law school. So his authority to say these things is just senseless or nonsensical.
We covered the rally. We included the statement from Robert F. Kennedy Jr. I alluded to early in the program that while there was criticism that it did not go far enough, it was fairly apolitical and conciliatory. And then we were contacted by a spokesperson for HHS who demanded we include a full statement where the HHS basically attacked us, the media, for purportedly exploiting this for political gain. I'm not sure what he meant by that. Does that surprise you?
Actually, no. This administration famously attacks the press. I'll say in this particular situation, and I brought a little bit of levity here, Andrew Nixon is the HHS spokesperson. He's also a little bit of a baby. He Googled himself, presumably, or had some kind of scraping alert him that my organization had done a profile on him, which we do with many of the appointees. This one says, who is Andrew Nixon? He's a body double for Christian Bale in the 2000s film American Psycho, and it goes on. He actually commented on it. He said, "We will make America healthy again without the help of fired liberal bureaucrats. Also, your information is wrong." If we want to talk about politicizing this situation, I mean, I think that all we have to do is look at this kind of comment and see that these attacks are politically motivated. The press is trying to report the facts, and the administration doesn't like that.
In fairness to Andrew, I think Gavin Newsom is a better body double for Christian Bale in American Psycho. I've always believed that, but fair enough. I wanted to ask, what comes next? Where does your group go from here? There's going to be an investigation. We've asked for details about how that is going to be released. What are you looking for? What do you want to see happen?
Oh, well, we want to see the restoration of public health as a vital government service. I mean, there's just no way. It takes the money of a country to support the American people in public health. So we'll continue to fight for the reinstatement of our employees. We will continue to fight for funding. If you go to cdcdataproject.org, you can see some of the consequences of the proposed cuts to CDC funding. And so we're just going to support employees as best we can. We do a lot of morale boosting activities. We have what we call unhappy hours. We have rallies. We support rallies at CDC. In fact, where the shooting occurred, on another day, there would have been 30 to 100 people there with signs, supporting our current employees, which, haunts me. Yeah. So we'll just continue fighting. That's what we do.
It could have been a whole lot worse, and it is very, very sad that we lost a really good person, David Rose, really the best our community had to offer in this really senseless tragedy. But we appreciate you joining us, Sarah, and we hope you'll join us again.
Yeah, I'd be happy to. Thanks, Dan.
If I could take just a moment to talk about this, because I am upset by it too. When I started Decatur Dish back in 2013, it was just me on my couch. And the people who supported us from the very beginning were people who worked at the CDC, and they couldn't always talk to us about what was going on over there because they were public servants first, and they cared about their jobs and the work that they were doing. But because they are such civic-minded people, a lot of them saw the value in having a strong local news source. So the CDC people, in addition to doing good work, also lifted me and my family up for a very, very long time before we sold our company. And it is hard for me on a personal level to see the anger and the pain that they are feeling, because these are my neighbors. This is my community. I love these people, and they don't deserve this. And if it is any consolation to my friends and neighbors at the CDC, one individual cannot take away all of the lives that your organization has saved by doing the important work of public health. And we thank you, and we hope that someday we can get back to a place in this country where we can embrace the objective good that is public health and science. Thank you all so much for watching this week's show. We hope you have a better weekend than we all had last weekend, and we'll see you next week. And that's the Decatur Dish Show. We tape every Wednesday at 12:30 p.m. right here on Atlanta News First Plus. To check out episodes of this show, download the Atlanta News First app. To get all the latest news from DeKalb County, visit Decatorish.com. And to hear this show as a podcast, look for Decatur Dish wherever you stream your podcasts. See you next week.